In the last 2 years, the Ebola outbreak has affected 10 countries, including Spain and the United States, officially causing 11,315 deaths out of 28,637 cases recorded. More than 99% of these have been in Guinea, Liberia, and Sierra Leone. At the height of the outbreak in 2015, UNFPA launched the Mana River Midwifery Response Initiative with governments and other partners. This project helped quickly reopen maternal and reproductive health services with the recruitment of more than 500 doctors, midwives, and health workers in Guinea, Liberia, and Sierra Leone. Through the project, more than 6,000 Ebola contact tracers were trained and thousands of reproductive health kits were provided.
Planning for the three countries is an opportunity for UNFPA to contribute to the post-recovery, the post-Ebola recovery plan of the three countries. As you know, the three countries are one when it comes to geography, they are one when it comes to health, they are one when it comes to transportation, and so on and so forth. And that was how the Ebola virus has actually come into the three countries. So we feel that women, particularly pregnant women and young adolescent girls who are pregnant, they need the support of UNFPA and the government of those countries to ensure that their pregnancies are well taken care of and their deliveries are safe.
The aim is to invest in the human resources, invest in the supplies and equipment, invest in infrastructure because most of them don't have electricity, they don't have water. We have been working to train midwives and work with the government to deploy them. We have been ensuring that supplies are available, but because of Ebola, many things broke down, and therefore this initiative is to really work again and look at strength.
Although there was a lot of focus on the population affected by the Ebola outbreak, the provision of maternal and reproductive health services by UNFPA in 2015 was not limited to the three affected countries. For example, in Senegal, Benin, or Cote d'Ivoire, thousands of women have benefited from the support of UNFPA in the areas of maternal and child health. At Popenguine, a town in the region of Thiès, Senegal, health indicators have improved. The birth rate in health structures is around 97%. The completion of antenatal care was 59%, up from 52.02% in 2013. With respect to family planning, Popenguine has reached 20% of contraceptive prevalence during the first quarter of 2015. These good results were achieved thanks to the commitment of peer educators and the financial support from UNFPA that was delivered through a solidarity fund that allows women to receive for free all reproductive health care services.
When we came here with no money to pay for the health care, we used to take from the 50,000 that were allocated to us, no matter the nature of the treatment, whether it was for delivery of postnatal consultations. We're working on birth spacing through Planned Parenthood. We engage with the populations, especially the couples. True, before they were unwilling, but now they understand.
Mindful, however, of the persisting sociocultural barriers with regards to reproductive health services, religious and traditional leaders as key influencers and the pillars of their communities will accompany UNFPA in overcoming these barriers. They affirmed their full support for the efforts of the UN agency in October 2015 during the regional consultation on the demographic dividend and reproductive health in Africa.
We have to invest time, our talents, our resources, and then we will yield significant dividends for tomorrow, for our young people tomorrow. The resources that we need essentially begin with ourselves in our churches, our mosques, the traditional places where we have faith communities are worshiping. We are the resources that are necessary to build the nation.
I think we're very careful here. Every religion talks about having decent family, about planning your family, And this time they're talking about you breastfeed for about 2 years and 6 months. That's 30 months. By the time you do that, and if the biological systems are working, there will be no period, there will be no baby. So the concept of planning a family is with everybody. But if you come and say, take, swallow, 16-year-old girl, then people get very angry. That's condom on the television, people get angry. If you do it within the context of family life, nobody quarrels. For example, problem brings a couple to you in the hospital, and you say, Madam, your health, your heart is not good. Take this medicine, it will stop you getting pregnant for the next 2 years until you recover. The husband will welcome it. You're welcome, but when you get into a young girl, say, take this, swallow, so you don't get pregnant. Then she over the street. That's what we don't like. So when you talk in context of family planning, family spacing, it's acceptable. But just prevent pregnancy, take, all of it. That's the one that we should teach them morals at school. But whether you like it or not, the world now is going, the internet, Facebook is giving all the ideas. So whether you give them or not, it's happening. Okay, so the young have a way. So really, if it's religious leaders, they will not tell you you can't space family. They will tell you unwarranted use of advertisement of condoms. That's what they object to. So when you go say no, that's what I'm saying. They understand you and they embrace it.
At Malhoki, a few kilometers from Yola, the capital of Adamawa State in Nigeria, or Sido, 900 kilometers south of N'Djamena on the border with the Central African Republic, UNFPA has been an integral part of all initiatives of the humanitarian community in 2015. From psychosocial support to humanitarian assistance, UNFPA has initiated a special mechanism to help the displaced persons, victims of armed conflict in northern Nigeria, Central African Republic, and Sudan.
She said there is a great difference. Here, they are under duress. Any slighting, they will beat them. Any slighting, they will insult them. They are not free. You will be kept in one place without movement. But here, they are very free. They find many people counseling them. They had made many friends. They sleep well and wake up well, and they eat good food. They are not scared again. That's the difference.
UNFPA provides support in 3 main areas. Our main areas is providing sexual and reproductive health services, and for this we provide reproductive health kits that are distributed to health facilities and to the women themselves. And then we also take care of areas around GBV. For that we ensure the prevention of sexual violence, management and responding to those who are already violated. So we train health workers to be able to provide clinical management of rape cases that come to them. The third area is the provision of psychosocial support. This is an area that has become very necessary because of the nature of the conflict in Nigeria. There was no way we could address the needs of the pregnant women without addressing their traumatic condition. It was a necessary need, so we had to bring on board this area of psychosocial support.
Chaque jour, on a au moins 10 accouchements que nous faisons avec les femmes.
Every day we have at least 10 deliveries. We attend with women here, and they're generally girls under 18 or others under 24. They're totally taken into account in prenatal consultations and all that goes along with it. We take them for family planning and in the site so as to coach them and make what is called counseling, meaning to avoid those deliveries and others. This is the first aspect. The second aspect consists in how they are taken in charge in the violence issues.
In addition to the provision of sexual and reproductive health services, UNFPA has also invested in the development of human capital, with learning income-generating activities such as sewing, soap making, or knitting. Activities that can promote the well-being, social and economic status of women who are rebuilding their lives in the camps.
UNFPA recently introduced what we call Skills Acquisition Program in this camp in NYSC Damari camp. This is one of the things that we really need for these IDPs, because most of them lost their livelihoods, and UNFPA came in at the right time, identified these IDPs, selected number of them that will be trained in tailoring, soap making, liquid wash, polygnething, and so on. And they donated materials that will be used in that training.
Il s'agit de passer de la réactivité aux crises humanitaires.
It is about going from reacting to the humanitarian crisis to its anticipation by giving means to vulnerable populations who are in need, for them to be able to resist from the shock and take themselves in charge. This day is a great day, as it gives us a unique opportunity to allow our populations to take themselves in charge and get out of turmoil, and that our actions become efficient contributions to the fulfillment of the 2030 Agenda for Sustainable Development, and mainly the 2033 Agenda of the African Union with its 6 objectives, which consist in building a continent where the women and children's potential is achieved.
Still, with a view to enabling women and girls to be independent and able to take decisions that will contribute to the sustainable development of their communities, in accordance with Sustainable Development Goals, UNFPA initiated in 2015 a program to empower women and girls of the Sahel, funded by the World Bank and in partnership with the West African Health Organization and SERPORT. Launched in Niamey in November 2015, this project covers Burkina Faso, Chad, Côte d'Ivoire, Mali, Mauritania and Niger.
C'est un partenariat d'un montant global de 205 millions de dollars US.
This is a partnership of an overall amount of $205 million, which will last 4 years. This aims to create the demand to improve healthcare services, maternal, child and newborn health, but also nutrition.
Les services de santé, santé maternelle, santé infantile et la santé néonatale, mais aussi la nutrition.
This program also seeks to assist countries to set up an ambitious program of social communication regarding behavior change.
Le projet vise également à sceller un partenariat gagnant.
The project intends to establish a win-win partnership with the countries in terms of improving the management and supply system of medical inputs regarding reproductive health, maternal, newborn and child health, as well as nutrition.
Concernant donc la santé de la reproduction, la santé maternelle, néonatale et infantile et la nutrition.
The project to empower women is a great opportunity for the Sahel region because it will allow the 6 beneficiary countries to accelerate their demographic transition in order to reap the demographic dividend. The commitment of African countries at the highest level demonstrates the will, the consciousness and the need for governments to reap the benefits of the demographic dividend. Some state authorities, such as the Prime Minister of Gabon and the Vice President of the Gambia, reaffirmed this during discussions with the Regional Director of UNFPA.
Congratulate the President Jammeh for the breakthrough in terms of banning FGM, and we find that this is excellent news, and now we look forward for the full implementation of this very, very important decision for women's health and women's rights here in the Gambia. The conversation then was about how can we go to scale, how can we scale up ongoing interventions that have been proven successful. We also discussed the issue of the resource constraint and the issue of how UNFPA can play a convening role and bring all the partners together so we can go to scale. And I think we know how to do it, and we're investing our limited resources. Now it's all about having all, I would say, partners who are really willing and able to support the Gambia to come together, to join the crew, so we can accelerate the progress we have seen in the recent past.
In the coming years, UNFPA intends to pursue its mission to support countries in accelerating the demographic transition and benefiting from the demographic dividend. This demographic dividend, which is an opportunity to seize, corresponds to the acceleration of the inclusive growth that could result from the age structure of the population.